My name's Jana Sacco, and I'm a general surgeon and hernia specialist here at UF Health Jacksonville. I absolutely love teaching, so the residency and medical students that I get to work with every day are a really big part of why I chose to come here, and I think helps us take really great care of patients. So basically, a hernia is a protrusion through any part of your muscle, typically on your abdominal wall. Some hernias you can have from birth and they grow over time. These are often at your belly button or in your groins. Probably the most common hernia is an incisional hernia, which happens after you've had an operation. That area where you had your surgery is never as strong as it was before, and so a bulge or a defect can develop in the muscle. These can grow over time and often will get larger if you gain weight. So there's a lot of different ways that we can fix hernias. There is open surgery, which is kind of the classic way that you can imagine, where we make an incision right over top of the hernia, and that is still required for a lot of patients today. But we also have a lot of advances with minimally invasive surgery, including laparoscopy and robotic surgery. This allows us to fix hernias through tiny instruments and a camera. Usually the incisions are less than 1 centimeter in size. This has really allowed us to speed up people's recovery. The majority of patients go home the same day of their operation, with the only restriction often being avoiding heavy lifting. So as we've discussed, a hernia is basically a hole or a bulge through the muscle. So there is really no way to repair a hernia without surgery. With that said, not all patients are symptomatic and therefore need a surgery. It's always best to discuss with your primary care doctor or come see one of our surgeons to see if you do qualify for a hernia repair.